Reviewing your 2023 Covered California enrollment and making changes. Hi, I'm Kevin Knaus with InsureMeKevin.com, and I serve all of California. And many people have been passively renewed into their Covered California plans for 2023, and you can make changes. Some people are kind of, oh no, I'm locked in. No, you can make changes to the plans. You can make changes to other household information. And I'm going to go through a few of those steps today. So when you go to your Covered California homepage, it'll say maybe welcome home, Chuck, welcome back. And even though you've already been enrolled in a plan, it'll say choose plan, because if you haven't selected a dental plan, they want you to select a dental plan. So that choose plan will always show, even if you are enrolled into a health plan that you like. And if you want to make a change, you can just hit report a change and you can go through and see everything in your application. The changes you are making, as long as that 2023 button is highlighted, are for 2023. They're not going to affect 2022. So let's say you want to look at your income section because things have changed at your job. So you can scroll, flip through the pages until you get to the income section. And the income section is the trickiest part of the Covered California application. And so you really want to slow down and just pay particular attention to it, especially if you're making any changes. I'm just going to review making a change to an existing income entry. You can add entries, but certain things happen, start and stop dates, and the start and stop dates are very important. So let's just look at Timothy making a change to his existing income, and he will hit edit. And that will bring up a new screen about how is your income changing. And that's where you enter the new amount. You'll see that for his current position at Pastor of Our Lady, it's $1,533. Well, he got a little bit of raise in October, and his monthly income is $1,583 now. So he enters $1,583, selects monthly. Now, you can put in a 2022 date and it's not going to affect your 2022 subsidy and enrollment. Sometimes people just like to keep it consistent, and you can put in, even though the income started in October 1st, you can put in 01/01/2023, because that's what the Covered California system is looking at. They're looking at the 2023 plan year. So Timothy makes that little small change to his income, and when he gets back to that income page, he sees two entries. The first one was for the Pastor of Our Lady, but you'll notice that the income started on January 2022 and ended 9/30/2022. The second entry, same employer, shows that income started 10/1/2022 and is current, meaning it's moving forward. And you can see it also has the higher monthly value that Timothy put in. What is important to review is down below the monthly income and the annual income. The monthly income is important because Covered California screens for Medi-Cal based on your monthly income. And sometimes when you add jobs, or maybe you've stopped the job, if that monthly income is too low, looks like a gap, that could flip you into Medi-Cal when really that isn't the situation. And that invariably always trips people up. So pay very, very careful attention to the monthly income and the annual income. So let's go and review the health plans, because maybe you want to change health plans. So on that welcome page, you'll be back there, and you can go right to choose plan if you wish. You can also scroll down on that home page and it'll show you the household summary. If there are any red dots by any of the household members' names, that means something is required. Generally, proof of income, might be immigration documents. And then down below there is the enrollment dashboard link, and you can click on that to review your enrollments. Now, when you are in the 2023 plan selection year, everything will default to 2023. You can always look at 2022 and some of the different screens, but the default is 2023. So that enrollment dashboard comes up, and then you'll want to click on My Enrollments, and that will bring up your current enrollment for 2023 with the subsidies. And you can do the little enrollment year drop down and select 2022 if you want to see what you're paying now, what you're enrolled in now. If you want to change your plan, do not hit cancel coverage. You don't want to hit that button. That's not the way to change plans. That's where you cancel. That's where you terminate your enrollment. You don't want to do that. Well, maybe. So you want to get back to your enrollment dashboard, My Enrollment Dashboard, that top link there. And then it will show, continue shopping. And the default is 2023. You can see the little blue line underneath there. So you click Continue Shopping, and then it'll bring up Shop for Dental Plans as the default because maybe you haven't selected a dental plan. If you want to select a health plan, you want to click on Shop for Health Plans for 2023. And then that'll show kind of a summary of what's going on, and that's where the Change Plan button is. Hallelujah, you found it, the Change Plan button. And when you hit Change Plan, and this is a very, very nice feature of Covered California, you can split family members up into different health plans. Maybe you want a bronze plan from Kaiser. Maybe your spouse wants a platinum plan from Blue Shield. That's perfectly acceptable. And that's also one way to lower your health care expenses because not everyone needs to be in a platinum plan. So you can select carriers and metal tier levels. So that's really super nice feature with Covered California. If you don't want to split all the family up, just want to keep in the same plan, just hit the Change Plan top button. If you want to split people, you would just check mark either Timothy or the spouse, and then you'd be shopping just for the person that you have selected. And Covered California knows the subsidy to be applied for that household member based on their age and the second lowest cost silver plan in the area. In this application, this example, I'm just going to do select all plans, for everyone's in the same plan. When you click that, it brings up this, confirmation of your plan. And you think, well, I thought I'm changing plans. Well, there's a little button down there in the left-hand corner that says back to shopping. You want to click on that. Covered California makes it kind of difficult to change plans, and that's good sometimes because that way it's hard to make a bad decision and goof things up. So you hit back to shopping, and then you're going to get another page, and it'll say remove existing plans and go shopping. That probably should be a question mark. Remove existing plans and go shopping? Why, yes. Now, you can click on that, and the plan that you're in won't show up. You'll see that shop and compare tool, all the different plans for the person you're shopping for or everyone, and then you can look at all that, and you can go through this multiple times because maybe you want to look at it with everyone in the plan, maybe you want to look at it just for plans for you or the spouse or your dependents. So you can kind of look at it a bunch of different ways because the only way to see the exact subsidy to be applied to the health insurance for each individual member is to do this. It's very difficult on the shop and compare tool to kind of do a comparison of subsidies for different people in the household. Also, as you go through this, unless you make an active decision, select enroll, add to cart, confirm, sign, etc., nothing changes. You can go through this multiple times, exit out, go home, log out, and your existing health plan will still be there. Believe me, I know, I do it. So you can't hurt it. You need to be proactive and actually select the plan and go through all the confirmation steps and pay for the plan to make the plan change. So you can keep doing that as much as you like, as long as you just exit out or go back to the home page. It's not going to change your enrollment because you're just kind of window shopping. You're just kind of looking at comparisons to see how everything works. So, as always, You may leave comments down below, and the questions you pose, I will do my best to answer them. You can go to my website, insuremekevin.com, get my contact information, phone or email, and I will try and answer those questions as well. So, for insuremekevin.com, serving all of California, I'm Kevin Canals.